tonight's top story, authorities say they are close to finding the group responsible for the anthrax attack at Tropicana Field. More on that in a moment, but first, the Pinellas County Health Department has opened all of their points of dispensing, or PODs. All residents and visitors are urged to go to a POD to get medication to counteract any effects from today's attack. A list of locations is available at www.pinellashealth.com. For more, let's go to our special report.
What are PODs? A POD is the temporary clinic where mass dispensing is done. They are for dispensing medication or vaccine to a large group of people in a short period of time. This may happen in a widespread infectious disease epidemic such as smallpox or pandemic influenza or biological attack. PODs are only opened when a large portion of the population is determined to be at great risk to a contagious disease or other biological agent. PODs prevent the spread of an infectious disease or help to keep people from getting sick. PODs dispense medications to everyone in Pinellas County within 48 hours of an outbreak. There are approximately 1 million people in Pinellas County at any given time, including residents and visitors. That means that almost 21,000 medications must be distributed every hour to meet our goal. The PODs are overseen by the Health Department Command Center. The Command Center provides assistance, materials, and additional medications as needed. They are the head of the ICS. Below the Command Center are the North, Central, and South Branch leaders, who are directly above each POD manager. PODs are located in public schools throughout Pinellas County. There are also 3 drive-through PODs located at St. Pete College campuses, one in North County, one in Central County, and one in South County. These drive-through PODs are faster, and clients stay in their cars much like a fast food drive-through. Drivers still need to fill out paperwork to receive medication. How do PODs work? There are 4 main areas of a POD. First, greeting and initial screening, where we welcome clients to the POD and provide extra copies of the patient information form to be filled out. In this stage, ask clients if they feel ill or are experiencing any relevant symptoms and direct them accordingly. If necessary, send clients to the medical triage area, our second area. Medical staff will be on hand to assess clients who are ill or experiencing symptoms. If these clients are deemed sick, they are sent to the closest hospital. If clients are not sick, they are directed to the dispensing area to receive medication. The third area is our form check. Here we review each client's paperwork to ensure we have all necessary information so we may dispense medications or vaccines. The final area is our dispensing area and form collection. Dispensing staff will double-check the paperwork, dispense the appropriate medication or vaccine, and direct clients to the exit. Pinellas County Health Department employees and volunteers staff the PODs. You will never be expected to do a task that is outside your knowledge, skill, or ability. Pinellas CHD staff who are eligible for emergency duty are assigned to a POD team and a POD role. More information on how to look up your assignments will be provided by Public Health Preparedness. Each POD branch has a regional leader that oversees all POD operations in their region. Regional POD branch leaders are the main point of contact between the POD managers in their region, North, Central, or South, and the operations chief at the HDCC. POD managers oversee all POD operations within their POD. They communicate directly with the regional leaders to relay information about the number of clients served or to request more supplies. Inventory managers monitor drug stock supplies and keep inventory of supplies. The inventory management staff should know at all times how much medication is on hand and ensure that resupply requests are completed at the appropriate times. Medical triage personnel determine the health status of clients and direct them to appropriate stations. For example, if a client has symptoms of the disease at hand, arrangements should be made to transport them to an appropriate healthcare facility. The floor operations leader coordinates all dispensing activities and monitors dispensers to ensure they are dispensing the proper quantities and formulations of prophylaxis. The clerical and administration leader ensures that clients are being greeted, provided information, and help is being given to those clients that need it, and that lines are kept moving through the elimination of bottlenecks. Clerical support workers ensure that clients are filling out the forms properly and that any potential symptomatic clients are brought to the medical triage area. The dispensing team quickly reviews the client's paperwork, ensures that it is completed, and dispenses medications according to the current algorithm. Runners are vital to POD operations. They provide efficient, quick means of communication, take material requests to inventory management for pickup, and deliver requested materials as needed. Greeters welcome clients as they enter pods, direct clients to the clerical support area, and assist those who require assistance. Greeters also help to ensure that any potential symptomatic clients are taken to the medical triage area. Traffic and flow control staff help to make sure that the pod is moving smoothly. Lines should be kept in formation to prevent issues, especially at a drive-through pod where clients stay in their cars. There are many types of supplies used at pods. First, there are the medications or vaccines dispensed. These may vary based on the type of incident that occurs. Always use local, regional, and state resources first. When they run out, supplies will be requested from the Strategic National Stockpile, or SNS. The SNS is coordinated through the Centers for Disease Control and Prevention, also known as the CDC. The CDC has large quantities of medicine and medical supplies if there is a public health emergency severe enough to cause local supplies to run out. These CDC supplies are available for quick deployment to state and local authorities. The medicine we dispense is free for everyone. Other supplies are found in our pod in a box, which contains clipboards, pens, markers, paper, boxes, tape, signage, megaphone, batteries, whistles, easel stands, easel pads, first aid kit, hand sanitizer, gloves, tissues, vests, lanyards, flags, and other items. Basically, everything you need to open and run a pod. There are 2 colors of vests included in the pod in a box: yellow or lime green for medical staff, and orange for non-medical staff. In the event that pods are activated, you will receive a call from our teletask alert system. The call down is just an alert letting you know you must call the employee hotline for deployment information, even if you missed the teletask initial call. It is your responsibility to know your pod designation and report to duty. Once you arrive at your assigned pod, check in with your supervisor, greet your direct reports if you have any, and inform them of primary and backup communication methods. Review your role and responsibilities, attend just-in-time training, make sure you wear the appropriate vest, then assist with pod setup. Always display your ID badge. Great job, Pinellas County Health Department! Thanks to the efforts of the health department folks, many people were treated before getting sick and lives were saved. The FBI has tracked down and arrested the group responsible for this attack, leaving Pinellas County, once again, a safe place to live.